afternoon. Well, there have been various reports over the last few weeks about a big spike in the cases of diseases that present with flu-like symptoms. Some children have been diagnosed with swine flu. The National Institute for Communicable Diseases says that there's also been some cases of COVID in the environment. Dr. Ramneek Ahluwalia is the CEO at Higher Health, looking at health in higher education institutions. Dr. Ahluwalia, good afternoon to you. What impact have you noticed in your institutions? What kind of picture are you seeing at the moment?
Good afternoon, Stephen. Stephen, you're right, actually. We have seen outbreaks, and we're seeing outbreaks of flu all across our institutions of higher learning. It's a flu season. You know, when the season changes from summers into winters, viruses love such changes. They love our human body at times, and they find easy escape route to survive in our bodies. So you are right. There are many strains that are moving around, and they all are airborne, and predominantly this is influenza season. So we all know the influenza virus causes. The RSV virus, which affects our children, and the flu from where it starts, is very common in the season. It's actually spreading very quickly. And of course, COVID. I mean, COVID has now become a human-to-human transmission. It's around us. Though there's no new variant, it's still the Omicron, but it's still moving around, and it peaks up in the season because the season gives them that happiness of moving from one person to the other. And of course, now swine flu. So many strains, many different viruses, all are presenting same flu-like symptoms. But of course, there are different viruses, and they have different infectious mechanisms, and they cause infectivity in different stages. And I think the aim is to inform people. In fact, for me, it's about telling young people who predominantly are in congregations, in classrooms, they are in congregation in residences, in libraries, where if it's less ventilated, if you're in close contact, the virus does find a very quick space because it's being airborne to one another. Usually mild cases, predominantly a flu season, but the biggest challenge comes in when it carries to a person with low immune system, it carries to a person who's elderly, your own loved ones, unknowingly we transmit, and they actually have fatal diseases or go to high infectious moments, which obviously becomes very challenging. And that's what we're seeing in hospitals, what we're seeing currently as a state. So it is something that we need to be observing ourselves and taking precautions around.
Is there anything that's happened this year that's different from what normally happens at this time of year? And I must say, I mean, I understand that you get different types of flu, and I realize that you do get cases of swine flu from time to time. I know that COVID, of course, is still with us. But swine flu is not entirely normal, is it?
So you're right. I mean, the slight difference will be is that swine flu has been active in the season, along with influenza, and along with COVID has added now. So where there used to be a predominance of one flu infection or two, which was RSV virus and the influenza, it's added with the two more in the battleground with two more additional viruses in the same season, in the same time, which has predominantly more higher infectivity. In fact, more faster moving from one human to the other should one human get it. So obviously that adds a little bit of complications to the spread of the season with the flu. Of course, as I said, every infection, every virus in a human body, though it appears to be flu and has similar symptoms as it's an upper respiratory tract infection, but some have higher infectivity, like swine flu has a more stronger infectivity and causes more challenges to a human body. It takes longer to get you out of the system. Your own immune system takes longer to fight versus a normal influenza virus. Again, what one has to remember is they're all airborne. So the precautions, the prevention remains the same. So if we can wash our hands before eating, if we can remember, if we shake hands with people in communities, if we can wash our hands regularly, it does help. If we can maintain small social distance to people who are infectious or probably have some symptoms. If you have some symptoms, staying away from your loved ones who are elderly or people, or wearing a mask in front of them, or asking elderlies to wear a mask for any reason there are symptoms in the house, it is very, very important, because that is how the virus only moves when you are symptomatic, which means you can spread the virus. You're coughing, you're having running nose, you have mild fever, you have nasal blockage. So these are the common symptoms that present during a flu season, and that is what one must be watching and observing themselves with.
Why do we suddenly have swine flu? I mean, it takes a long time, as you say, it can take a very long time to recover from. I mean, why would it suddenly arrive now? Is it just one of those things?
A lot of cross-border, our ports are open, flights come on daily basis, people travel all over the country, all over the world. The world has become a very open space of engagements. Tomorrow morning I'm speaking to you right now, and I might catch a flight tonight, and I will be in Europe or in India or in China or anywhere else. So every place has infections and viruses moving, and that makes somebody a carrier and carries. And people do continue, even if they have mild flu symptoms, people will carry. So the virus is moving with you in a human body. So the challenge with the world and with the system now is that it's become open. So swine flu could have originated in any part of the world at this stage. But obviously, with our seasonal change, with our with where we find ourselves in entering into winters, which is predominantly what the virus loves, if some human body carried this to South Africa, it starts moving from one person to the other person in close contact with others. And as soon as you have little low immune system, some symptoms are more, and which means your longevity of having symptoms will lead you to longer transmit the virus to other people. And that's how viruses spread, specifically airborne. We've seen in COVID what happened. And that's exactly how I see swine flu or influenza or other viruses that are in the same phase. Again, they are mild viruses. There's no panic in reality, but one needs to be observant, specifically for the elderlies, for young people who have low immune system, people with HIV, people with diabetes, people with chronic diseases. They, unfortunately, we see fatalities, we see hospitalization, we see severity of the disease. And that's what we need to be protecting ourselves. And unknowingly, we, with sometimes good immune response, might be in a position to transmit this virus to them during our 3 to 7 days when the infection stays with us. And we just need to be careful in that period.
And Dr. Ahluwalia, I mean, is this all going to get worse as the weather gets colder? I mean, probably from next week. Who knows what next week brings? Could it get worse as it gets colder? We all get, closer together?
So you're absolutely right. It does. In fact, we've seen a predominant spike in the last 1 week comparative to what it was, say, about 2 weeks back. So yes, I mean, this means large amount of population is getting flu and is becoming household to household. So the only thing is, what we have to do in winters is to make sure that the ventilation remains in the room. Follow the basic, we call them hygiene etiquettes, from washing your hands, maintaining social distance, wearing a mask when you have infection or you're meeting somebody with infection. And if you do follow, that you do not want is this virus to move from your hand into your nose or in close proximity through kissing or hugging, if you can avoid it, please do avoid. If somebody has infection, watch it very clearly, or request people to be able to stay at home during the days when they have infection. So these are the only way one can control a virus in a season which is cold. What cold does is it makes people sit in close ventilation, in close proximity together, and that makes easy movement for the virus to move from one place to the other. But unfortunately, Stephen, this is something which we can only try. But one needs to know this is again mild. 3 to 7 days, you will be over. Just too careful to the people who are very old, people who have low immune system. And that's where the precaution goes towards.
Dr. Ramneek Ahluwalia, thank you, CEO at Higher Health. Really do appreciate the time this afternoon. All right. Well.